So, could you please state your name for us?
Yes, it's Diane Kuhn.
Could you tell us, when have you recently been in contact with a nurse?
Tuesday, October 27th.
Would you say that your experience with the nurse was positive or negative? And will you explain why?
It was quite positive. She was very caring. She was very concerned about my well-being. She was very knowledgeable of, things she was telling me, questions she was asking, and it was a very good experience.
So, based through the media, what kind of image do you get about nurses?
Oh, to me, nurses do not get as much credit for the job they do. I don't feel that they're given credit for the amount of work they do. I think that most credit is automatically given to physicians because they're the doctor, but the nurses do most of the physical and most of the practical work. The nurses do it. The doctors, diagnose and everything, but the nurses are the ones that carry everything out.
So, based upon your beliefs about nursing just from the media, do you feel like this is a positive image for nurses?
I think that it could be a positive image for nurses if they were portrayed more often. There's not enough media about nurses. In my opinion.
Do you think there's not enough good media or not enough media, period?
I don't think there's enough media, period, about nurses, their training, the jobs that are available to them. I just think that the media tends to ignore nursing as an afterthought of healthcare.
Do you think that the media portrayal of nurses, like in TV shows or like in movies, do you think that that has the effect of the trust that you have for these nurses? Do you think that they're going to be bad just because, like, say, Grey's Anatomy portrays them as being sluts? Or...
Well, the bad thing about TV portrayal nowadays is that they kind of put more of a person's personal life into a program that has nothing to do with how they do their job. And I think that most shows portray nurses as being able to do the jobs that they're given and then some. But unfortunately, because of reality TV, they also throw in the other things that have nothing to do with their jobs.
Based on what you said earlier, do you think that the nurses play a very active role in patient care?
Oh, absolutely. They play, I say, 85-90% of the active role in patient care.
In rating the quality of your nurse when receiving care, do you believe that professionalism or attractiveness is more important?
Oh, professionalism. I don't think what a person looks like has anything to do with how well they can do their job.
After your time in the hospital, what has changed about your opinion and view of nursing?
Nothing's really changed in my opinion other than, like I said, I don't think that nurses are giving credit for the amount of work they do.
So, have you heard about the controversy that was caused on The View when the main woman said that she was joking about the American Idol woman saying that, why does she have a doctor's stethoscope?
Right, talking about the stethoscope thing and why did she have that on.
Yes.
Well, let me tell you, running in and out of work, a nurse doesn't always think to grab her stethoscope off. And a nurse has to have her stethoscope. And doctors aren't the only ones that use it. That is just the silliest thing that I ever heard to even have a controversy over.
Do you think that what she said negatively affected the image that nurses have?
I don't, because I think people are smarter than that.
You do?
I do. I think that the average person knows that they're going to get good quality of care from a nurse.
Okay.
As well as their doctor.
All right. And our last question. Do you have any recommendations to improve the image of nursing for the future?
To improve the image? I just wish they would portray an image. I'm not talking about television programs, reality shows, that kind of thing. I'm thinking more along the lines of commercials. They put plenty of commercials out about medications, about physicians, about insurance, but they don't do enough to portray nurses. And I think that they could do a lot more towards, portraying nurses and what they do.
So you're saying if they have more commercials saying, oh, be a nurse, you can do this and this, that would help our image?
Right, but I mean, not necessarily be a nurse and do this and this. This is nursing. And show the kind of compassionate things that the nurses do. The kind of caring, the level of care they do. How they're the ones right there most of the time when your doctor's not, and when you need that extra care, the nurse is the one that's there. Show that side of nursing, and it would be kind of like the military, be all you can be a nurse.
Well, I think what you said is the perfect definition of what we were trying to portray for nursing.
Thank you.
And thank you so much for your interview.
You're welcome.